So we just talked about different structures that I want you to try and palpate on yourselves and on family member as well. So looking at it on the spine model, if we look from the front, here are our ASISs. So if we look from the lateral, you can see how they're the most prominent bony bumps sticking out anteriorly, and that's why they're so easy to feel on ourselves and on other people as well. You can follow the iliac crest posteriorly, and you end up on the PSIS, so it's most prominent bony bumps sticking back posteriorly. If you rest your index finger on the iliac crest of an individual, your thumb naturally tends to fall on the PSIS, so that's one way to landmark where it is. We can see our greater trochanter, so those bony bumps that stick out to the side, and you can see its relation to the femur and then the hip joint with the acetabulum. Now, where our ilium or ilia meet the sacrum or tailbone, we have a joint on each side, and that's our sacroiliac joint, or SI joint for short. There's not a ton of movement that occurs in that joint, but there is a little bit when we flex and extend our hips, so to allow us to walk and especially to run and squat down as well. Some people have limited movement in one or both of their SI joints. Some people have too much movement in one or both, and we can assess that mobility. I'll show you that in the next video, where you have index finger on iliac crest, thumb on PSIS, and asking family member to stand and bring thigh up towards their chest. And when that happens, the ilium on that side rotates posterior, and the PSIS should dip down, and your thumb will move down with it. And then when they stand or bring the leg back up to standing position, then the PSIS comes back to its normal position, and then you check on the other side. So you're just making sure that movement is the same on each side. Some of you may have a family member that has told you they have one leg that's longer and one leg that's shorter than another, or you yourself may have been told that you have one leg that's longer than the other. And almost always that doesn't mean that the bones are a different length. What it means is that you have some rotation through the pelvis. So if the pelvis is rotated posteriorly, we can see how that acetabulum, or where the hip, proximal femur joins onto the acetabulum, when we rotate the pelvis posterior, the acetabulum comes up a little bit higher. So if somebody has posterior rotation in their ilium and it's stuck in that position, then the acetabulum is going to be a little bit higher up, and it's going to give them the appearance of the leg being shorter on that side. Vice versa, if the acetabulum, or if the ilium is rotated anterior, the acetabulum or socket is going to be sitting down a little bit lower, and it's going to give the appearance of that leg being longer than the other one. So there's measurements that we can do, measuring from the greater trochanter to the lateral malleolus of the ankle, and that's checking the length of the bones. Then we'll measure from the ASIS to the lateral malleolus, and that's measuring for rotation through the pelvis, because ideally the measurement should be the same from side to side, whether it's from the ASIS or from the greater trochanter. It's when somebody has rotation through the pelvis that the measurements from the ASIS to the lateral side of the ankle is going to be different, and that's our functional leg length difference. If the measurements were different from the greater trochanter to the lateral malleolus of the ankle, that would indicate that there actually is a difference in the bone length, but that's very, very rare.